I work on valley fever, also known as coccidioidomycosis, also known as COXY for short, and it's a disease of the southwest United States and parts of Mexico, Central and South America. Arizona sees 60% of the United States cases just because the valley fever fungus thrives in the desert-like environment. The Arizona Biomedical Research Commission provided us funds to support valley fever investigations, and so we were able to interview a small sample of our valley fever cases to understand more about their symptoms, how long it took them to see a doctor before they were tested, whether or not they knew about valley fever before, whether or not they were exposed to any dust, any outdoor exposure at all, since the valley fever fungus thrives in the desert soil and the spores can get picked up into the air. The funding that ABRC provides allows us to investigate valley fever at the health department. Without those funds, we have very limited funding from other sources, whether it's state or federal grants that can provide funding for valley fever. So what we can do with the money that we're provided is to understand more about valley fever and see where the gaps are in terms of physicians' knowledge about it and where we can better target educational efforts, and also just having a better understanding of how the testing works. Once we know more about the testing, we can give recommendations to doctors so that they can better diagnose their patients for valley fever. We surveyed physicians to see what their knowledge level about valley fever was at, whether or not they're providing the appropriate treatment, whether or not they knew it was reportable, whether or not they knew if valley fever has a vaccine, which there unfortunately is not a vaccine for valley fever. A handful of scientists are doing research on a vaccine for valley fever, and some of the research seems promising, but the issue with developing a vaccine for valley fever is the support from pharmaceutical companies. Because valley fever is a regional disease, it's not very high on the market in terms of profit. Once a vaccine is here, it will take some time before you'll see the long-term effects. It won't be instant, but I think over time we'll see fewer and fewer cases. Valley fever is Arizona's disease, and it's really important that we have funding to do investigations to understand the disease better. It can be devastating to have valley fever. You can be on the drug for your entire life if it does get to be the severe form. So it's so important to be aware about this disease and to understand it better. And our main take-home message is, if you're having a fever, a cough, or feeling exhausted, to be proactive about your health and get tested for valley fever.